We are here with Dr. Sean Roden, who is the physician at South Pole Station this year. So, Sean, can you tell us a bit about, just what you do here and, the capabilities of the medical facilities here?
Absolutely. So my name is Sean Roden. I'm a medical doctor here at South Pole Station. I'm a board-certified emergency medicine physician, and then also specialize in aerospace medicine and been a NASA flight surgeon for the last 8 years. I ran into an old colleague, Scott Perzinski, who's an astronaut and fellow physician, who's now the medical director for the South Pole, for Polar Medical Operations at UTMB. So he hired me. I came down here to spend the austral summer of 2012 and 13 as the medical officer for the South Pole Station.
Okay.
And this is our clinic.
All right. So can you tell us a bit about your background? What has been your experience in medicine? What got you started in it, and what kinds of different experiences have you had that actually, put you in a position where you can be the emergency physician here at South Pole Station?
Yeah, absolutely. I started out as a paramedic in West Texas and in Austin, Texas. I did further training in education in genetics and got my master's in genetics and went on to medical school. I spent my last year of medical school with the Royal Flying Doctor Service of Australia, taking care of Aborigines and stockmen in the bush of Central Australia. I did my residency in emergency medicine and was a private physician in emergency medicine in Texas for 5 years. Then was accepted to the NASA UTMB program for aerospace medicine. Did a fellowship in aerospace medicine and was sent to Russia for 3 years at Star City, Russia, where we took care of astronauts while they're training for the International Space Station missions that they were assigned to. I then became a civil servant flight surgeon at NASA and was there for 5 years after my stint in Russia. I was the medical director for the International Space Station for several years, and also was one of the physicians for the microgravity platform, which is a plane that does parabolic flight and gives you microgravity or reduced gravity experiences for about 45 seconds. I left that about 2 years ago, and like I said earlier, I ran into an old astronaut /patient of mine, Scott Perzinski, and came down here to be the South Pole physician for 2012-2013. Okay,
and so what I guess do you find most fascinating or interesting about being here in Antarctica at the South Pole?
The South Pole is an interesting environment. We're at altitude, on average about 10,000 feet to 10,500 feet. So a lot of people have a time acclimatizing to the altitude, which is different from where they are, especially me being from Houston at sea level. It's a very austere environment. It's a desert, even though there's surrounded by snow. There's no humidity, so that develops some problems with the skin. For the most part, it's a very enclosed environment. We live on a station that has a controlled atmosphere, so we have to be very careful about controlling pathogens as far as just like the common cold or just common flu symptoms. For the most part, everybody's very healthy here, and there's really no major issues. But as you can see from the clinic, if for some event we had an emergency, we have all the equipment that we can need or require to handle any type of emergency.
Have you had to do surgery on anyone?
We have not had to do surgery this season, but as you can see on this bed right here, this is a surgical bed, and we have done surgeries here at the South Pole. We have our surgical lights that we keep stowed until we need them, but pretty standard equipment that you'd see in an operating room. It's a little more austere than what you'd see, but we have all the capabilities to do surgery, orthopedic injuries. If somebody were to fall or break their arm, we've got all the equipment here to set their fractures. We have an x-ray machine over here. It's a really interesting little device. It's developed for the military for field injuries. And what you can do is, here, I'll even pull it out for you just real briefly so you can see it. It's just a little wheel device that we can deploy the legs and pull this out, and we can take x-rays, and then the x-rays are sent to Galveston, Texas, where they're cross-read. We can see the images here, where we develop them here. We have an x-ray device for dental procedures, and our dental suite is over on the other side of the clinic. And it's basically what you'd find in any typical dentist office, is the dentist chair and with the patient. We have all our radiological suites here. We have an ultrasound device where we can do ultrasounds.
Okay.
We can do EKGs. We can take care of any type of medical or surgical common injuries or life-threatening injuries here. We really have a well equipped
And so if something does go wrong and you do have to have medical procedure done here, how long would it typically take to get folks to Christ Church, which would be the next, I suppose, the closest major facility?
In the event of a condition that require a medical evacuation, it can go up to 3 to 4 days to get out of the South Pole. We would then transport the patient to McMurdo, and from McMurdo to Christ Church. Under the best of circumstances, probably 24 hours, and under the worst of circumstances in the summer, 3 to 4 days. Okay. And of course in the winter, there is no evacuation from the South Pole. There has been one in 2001 that was quite an intrepid medical evacuation.
Mm-hmm. So if you get in serious trouble when you're wintering over, you're pretty much stuck here.
Absolutely, and that's why the capabilities of the clinic are so robust.
Okay.
We plan every ability to take care of folks here in the winter without being able to get out.
Well, Sean, thank you so much for the tour of the medical facilities here at South Pole Station.
Thank you.